The acceptance or neglection of the COVID-19 vaccine by clinical and non-clinical healthcare facility staff can have a positive or negative impact on the uptake of COVID-19 vaccines among the population, as they are seen as a reliable source of health information. The question is, why are people not vaccinating? Can we attribute fear of the unknown to the low number of vaccinated individuals?
People are refusing the COVID vaccine just because some think and they are assuming that when they get the vaccine, they are rather introducing the COVID virus into their system for them to get the COVID, because they are afraid that they will die instead of being immune or being protected. And more so, some people are thinking that because of the reaction, the serious reaction that people got out of the vaccine, so they are also afraid that instead of getting the vaccine, they would rather have another disease or introduce another problem into them. So they are refusing it.
According to the World Health Organization, as of 22nd May 2022, almost 1 billion people in lower income countries remain unvaccinated. Only 57 countries have vaccinated 70% of their population, and almost all of them are high-income countries, meaning we must continue to support all countries to reach 70% vaccination coverage as soon as possible, including 100% of those aged over 60, 100% of health workers, and 100% of those with underlying conditions.
I'm a diabetic hypertensive, but I got it all right. But because of the vaccination that I had, it was so mild for me and I was okay. So people are also thinking that, especially the men, they think when they get it, they will be impotent. They will not perform well. But it's not true. All are mere saying. So please, I'm advising each and every one who haven't taken the vaccine, the COVID vaccination, please go to any vaccination center and take the vaccine. It will help you. It has helped me a lot. So I'm also advising everyone who has not taken it to go for it.
It is in this light that government and private bodies have come up with innovative initiatives in advocacies, publications, public education, and others in a quest to promote COVID-19 vaccinations, which will help prevent spread of the virus. One of such initiatives is the COVID-19 vaccination campaign by the African German Health Association, with support from GIZ, Ministry of Health, and Ghana Health Service.
This project supported the COVID-19 situation in Ghana by sensibilizing on the important aspects on how COVID-19 vaccines are being handled, disposed, and perceived among the several stakeholders in Ghana. This has been done within 5 different work packages. The first one being cold chain and supply chain management, where stakeholders from Ghana Health Service exercised the modification and adaptation of modern cold supply chains in order to strengthen the resilience of them in case new adaptations are required. In the next 2 work packages, healthcare waste management and infection prevention control, 10 vaccination centers have been assessed in terms of their critical equipment, but as well their procedures. This has been used in conjunction with Ghana Health Services information to create a knowledge exchange program in which all vaccination centers benefited from the various findings from these topics. In the next work package, we targeted healthcare workers. We conducted a COVID-19 vaccination campaign to increase the acceptance of vaccination among healthcare workers. We visited several healthcare facilities, provided information and talked with the healthcare workers, and answered frequently asked questions. In the last work package, we had expert discussions with Ghana Health Service on the DHI2 system on tracking of COVID-19 vaccines, which is recommended by the WHO. Successes and challenges were exchanged in great detail in this work package.
This project intends to contribute to COVID-19 vaccination campaign in Ghana. This will be achieved through capacity building and knowledge exchange between Ghana and Germany.
Some of the highlights of the project is the fact that we're able to donate to these selected facilities. through the sponsorship of the German Development Corporation. Some of the items that we donated to these facilities are outdoor canopies, waiting chairs, PPE packages, tablets, and also our famous vaccine fridge to the Gais Municipal Hospital. Also, one notable highlight is the fact that when our facilitators and experts for infection prevention and control and healthcare waste management went around for the refresher trainings and then the mentoring sessions, they saw that all the issues that were identified during the site assessment and also discussed at the workshops were no longer persistent. They had already improved on them or by way of eradicating those challenges.
Infectious diseases, including COVID-19, can spread easily if proper IPC capacities are not available. This goes hand in hand with the need for capacity building in related areas such as application of PPE.
AGA and GIZ organized a COVID-19 vaccination project for Gan East Municipality, in which Taifa Polyclinic was one of the facilities that benefited. It initially started with an assessment of the vaccination sites. That's where we do our COVID vaccination at. They identified the shortcomings of the sites, and they organized a workshop for us for 3 days, where they addressed the challenges identified so that we will be able to improve our services that we render to the community in the Taifa sub-municipality. Based on that, a one-week vaccination project too was organized for us to be able to vaccinate the people in the community with the available vaccines. And we implemented all that we learned from the workshop they did for us. And at the end, it was very impactful. GIZ and AGA helped us to be able to achieve our targets and even impacted the population positively with regards to COVID vaccination. And afterwards, GIZ and AGA gave us chairs to be able to address our issue of shortage of chairs for our people when they come for vaccination. And then they gave us bins, color-coded bins, so that we will be able to sort our waste properly to prevent infection.
We participated in the COVID-19 vaccination program, which I think has been a very useful thing for my municipality, because our staff have gotten exposed to vaccination practices outside what we are used to in Ghana. We have also been given a lot of knowledge with regard to infection prevention control, waste management, how to set up our vaccination sites, and also how to deploy vaccines using the logistics management system. The interlearning between Ghana and Germany with regard to the COVID-19 vaccination is quite useful, and it will bring up more findings, because in Ghana, COVID-19 vaccination has been made a part of our routine vaccination delivery. However, in Germany, it appears it runs as a separate activity, and for us, we'll pick the best practices from what we have seen with the way vaccines are delivered there and incorporate it into what we are already doing here. In the same way, we also hope that what we do here as part of what we call our routine vaccinations will also be used to impact on how COVID-19 vaccinations are delivered to the population in Germany. I would recommend that the COVID-19 vaccination program, as part of the teachings and the trainings given, also procure some logistics for the staff to be able to work. So logistics for instance, waste management, personal protective equipment, and also logistics that will help with data management, that is entry of the COVID-19 data and also processing of the data for our database.
Overall, I would say that the project was very successful and impactful in the sense that the donations we did for these facilities were very timely. Also, we did more than a double of the number of facilities that we had to do for the increased acceptance of
COVID-19 vaccines among clinical and non-clinical staff.
Aside that, there were several direct and indirect impacts from the project, in that there were exchange of knowledge between Ghana and Germany, and then capacity building for these healthcare staff.